Today we're here with Sabrina Kornegay and Paul Lascara. Right, how you guys doing?
Doing well.
I appreciate you talking with us. We're here at the Goldsboro Family Y in a very warm room. Now this room is supposed to be this warm, isn't it?
Yes, it's warm. It keeps the water at a nice, warm, thermoneutral temperature.
All right, now there's two swimming pools here. This is the smaller of the two.
Yes, sir.
And it's so warm in here for a reason. What's the reason?
The reason is to keep this temperature warmer than the other temperature pool. The reason there, over here in this pool, we're doing a lot more of faster, higher intensity swimming and things like that. Your body's going to warm up a lot more. This one, we're using that thermal effect of the water to kind of keep your pain down, manage it, so we can do more therapeutic type activities.
Okay, now this is what you do, right? You're an
Yes.
aquatic therapist.
Yeah, I'm a physical therapist assistant, and I actually specialize right now in aquatic therapy.
Okay, and Paul, what do you do?
I'm a clinical student.
Clinical student, and you're here helping us out today, is that right?
Yes, sir.
Now, Sabrina, who do you represent? You're with a company. What's the company you're with?
Yes, sir. I'm with Orthopedic Physical Therapy. We're an affiliate of Wayne Memorial Hospital.
Excellent. Great job. Okay, so tell me, who would take advantage of this?
The water is great for a wide array of patients. It can be anyone from your athlete who's had an injury, who's looking to get back to higher intensity stuff, but maybe they have a protocol like an ACL or something where they can't do higher level stuff just yet. We can kind of offload their body using the properties of the water. It can also be someone who maybe just has pain in general. Like I said, the thermal effect of that pool is going to really reduce the pain, so maybe someone with fibromyalgia even. We see a lot of total joints, maybe someone who needs strengthening, let's say just general muscle weakness, we're trying to get stronger. Maybe normal therapy on land, wherever they're going, it's painful. Well, we can do a lot of those same things in the water, using a lot of these properties of water to get them stronger, keep their pain managed while they're here so it doesn't have to hurt to do those activities.
Okay, two things. Number one, it's the resistance of the water that helps make this work. Is that right?
There's a lot of proproperties in that water.
A lot of properties,
yes,
not just
the
resistance.
The resistance is what's helping to build that strength. Their muscles are being resisted every which way they go.
Okay.
The thermal effect is going to help to manage the pain. The buoyancy of the water is going to reduce some of their weight so that they don't have all that pressure on their joints. That's really common with like patients with back pain, for example, where gravity's kind of compressing their spine. You get in the water, and that feels a lot better.
Yeah. Okay, and number two, age is not that relevant, is it? Because you keep talking, you're talking about injury to athletes, you're talking about people who have back problems, that could be any age. Muscle problems, skeletal problems?
I have seen my very first clinical affiliation when I was a student, like my buddy here, Paul. I worked with a pediatric patient, a really young girl. She was about 3 or 4 years old. She was having a lot of problems walking, and we used that water. She was a lot more focused in her treatments, and just there's some soothing properties in the water in and of itself that can kind of calm her down and relax her. There's a lot of fun things we can do to make therapy fun and attentive for younger children as well. So anyone who's aged, maybe they can't walk anymore for some reason, or they're a high fall risk. The great thing about the water is I can get them in here and they can do stuff in this water that they can't do on land without risking the falls. So it takes that risk of falling out of there. It frees up my hands to do lots of fun things that maybe we can't do on land or we can't do with just one person.
Paul, I meant to ask you where you're a student.
Nash Community College.
Nash Community, Rocky Mount.
Yes, sir.
All right, very good, very good. So you're a student in Rocky Mount. Do you live here or do you live there?
I live in Raleigh.
Oh, boy, is that confusing. Okay. Well, I'm glad you're here. That's okay. It happens to me a lot. So tell you what, let's look at some of the equipment you use to make these things happen.
Absolutely.
All right, let's go over this way.
Okay. We will start with the simplest probably thing that most people have already seen.
Oh, yeah.
And that's our basic pool noodle. You can find it at the dollar store. When we work with patients, a lot of them, we try to get to the point where they're managing things on their own. So sometimes we even see patients just 1 or 2 times just to show them exercises they can do safely on their own.
So what would somebody do with that?
What you can do with this, one, you can use it for support. Let's say you have a tendency to fall or unbalanced in the water. You'll kind of hold that and it'll keep you a little more upright.
Okay, I can see that.
Because it's buoyant, you can use it for resistance. So if I were working on your legs in the water, we're going to test my balance here.
Okay.
We're going to come up and press down.
In the water.
almost like a leg press. What's
Gotcha.
happening is that buoyancy is pushing that noodle up, and then you're having to push it back down.
I see. I see. Because
Against
it
the
wants to float up.
resistance. Yes,
Yeah,
it's
I got
wanting
it.
to float up.
Duh.
We have different size noodles. That's
Yeah.
going to make you have to work harder if you're doing this exercise, but if it's for supporting, it's going to give you a little more support the thicker that noodle is.
All right. You know, I was once hit with a wet noodle.
How did it feel?
Yeah. Okay, what else you got?
More advanced things that not many people see are hydrotone equipment.
Uh-huh.
This is really new to
what?
us.
What is it?
It's hydrotone. Well, these are called hydrotone bells, and these are called hydrotone boots.
We have a bell and a boot.
Yes, well, we have two of each.
Okay,
actually.
two of each.
These will go on your feet like nice little boots,
Okay.
and then these usually go in your arms. They're not necessarily just for arm or upper extremity exercises. We use them a lot for core strengthening. That's what's going to help reduce your back pain for a lot of patients. It's going to help keep you from falling, more stable and balanced when that core is nice and strong.
Yeah.
I've been told they don't make these anymore. It was hard for us to get them, so.
But they work.
They work great.
Why they stopped making them?
I know.
That's a shame. Okay. What else we have?
Okay. What else we have?
What else we have?
We have. This is called a Wonder Board.
I wonder why.
Yeah, me too.
Yeah.
No, I actually know. You can use this for several different reasons. I use it mainly for balance and core stability. So we can do seated exercises on the board. As soon as you sit on it, it kind of makes you wobble back and forth. You're having to stabilize.
Yeah, but you don't fall down.
Let's hope not.
You wobble,
That's
but-
what I'm there for.
Oh,
I make
okay.
sure they're safe, and for those patients that don't want to go under, we make sure they don't fall under.
Got it.
Some people are fearful for the water, so we take that into consideration, keeping the patient safe. We've had a lot of success stories of people that were really scared of the water and are actually now coming in on their own to the Y and to the pool and doing it all by themselves.
Wonderful. Okay.
So, this as well can be used. I mean, I've used it to do like push-ups in the water almost for some of my patients.
Wow.
Kind of getting that resistance as
Okay.
well. There's a lot of the equipment's very versatile.
Now,
Your
if you're-
imagination is as far
My
as-
imagination's running away with me here. Now, if you're doing push-ups in the water, are
Yes,
you
sir.
actually under the water?
No, you're above the water.
Oh,
You
thank
hope.
goodness.
as long as we're here, you're going to be
Okay.
above the water.
All
But the difference in the water is you're getting a lot of core strength too. You do
Right.
get that on land, but number one, you don't have the pain, and you're working the muscle very effectively without too much body weight that may injure your
Yes.
muscles.
Brilliant. Okay, what else do we have? This is fun.
It is fun. What else we have?
What else we
These
have?
over here, these are some of my favorites.
Oh boy, what is that?
These are called burdinkos.
Whom?
Burdinkos.
I knew it.
Exactly.
That's what I was going to call
If you
them.
can't say it, it must be good.
Yeah.
So,
Okay.
with these, we use them. Some people call them water walkers. They're like platforms that go on your feet. We can use them for basic, just ambulation activities, kind of walking to get some general strength.
Okay.
So you're pulling up and it's resisting
Uh-huh.
one muscle. You push down,
down.
it
Got
resists
it.
another. Or we can take patients to even deeper water and do even higher level activities to strengthen specifically the legs. Also cardio. So I've seen some patients
Okay.
even for weight loss, maybe their doctor was thinking about doing a knee replacement on them, but said they weighed too much, they didn't think they were going to get any better. So they come to me for a home exercise program. I show them how to monitor their heart rate, and we get them in the water, we get them moving. It takes time, it doesn't happen overnight,
Oh, I'm
but
sure.
they can begin to learn safely how to exercise and then start losing that weight so that they can get that knee replacement and make that pain go down.
Fantastic. Wow. Wow. Okay. What else we have here?
We have lots of different, these here are more for our upper extremities usually. We've got the plain paddles,
Okay.
and these things are attacking me.
I
Sorry.
say yes. I've known them to do that. Yeah.
They're good. You have to watch out when you can't say the name.
That's right.
So we can move these all through the water, back
Uh-huh.
and forth.
I
I
see.
can adjust the resistance.
Really?
So the greater the surface area, here comes another property of water, that's viscosity.
Got it.
The greater the surface
Oh, I
area
see.
through the viscosity,
Yeah.
the harder it is. So I've seen patients who have had rotator cuff surgery. Maybe they don't have the right motor pattern. Maybe they lift that arm and hike it way up high,
Yeah.
and then they start having neck pain and everything else. We
Okay.
can use the water to kind of assist with that, get that motor pattern correct so that they have more functional, more normal motions,
Okay.
less pain, less compensation. These can be used for arms, like pressing down. They can be used to balance,
Yeah.
similar to the noodle.
Got it.
They can also be used, I've used them to do different core exercises, crunches, things like that. The patient's having to work harder to stabilize in the water
Right.
than they would per se on land where they're laying on a table. But because they don't have all their body weight on them, I know, we're trying to fill up the pool. That's what all that is out there.
If you hear a lot of noise in the background, it just started pouring down rain. Isn't that nice?
Yeah.
And we're trying to fill the pool. Is that what you said?
Yeah.
That's funny. That's good.
That's not really how they fill the
No,
pool,
that's not
just
how
in
they-
case
no.
anyone thinks that.
Just kidding around.
We're basically offloading them where they can still do those exercises again that may be painful in water. So I can reproduce some of the things people do on land in water with less pain.
Okay. Wow. Boy, you got all kinds of toys.
I have lots. This is just basically a noodle for your neck.
A neck
around
noodle.
your head there.
Okay.
I'd put it around you and show you, but it's pretty wet still, and I
That's
don't
all
want
right.
to mess
I'm
up
a
your
wet kind of
shirt.
person there.
It will float and keep the patient's head above water.
Okay.
This may be used for a fearful patient who's just scared for their head to go underwater.
Okay.
Or I use it a lot whenever I'm floating patients on top of the water
Yeah.
to completely decompress their spine and offload their joints. It's a great, great pain relieving modality. A lot of patients, even those that are fearful of the water, once they try this, that first time they're going, oh no, oh no, oh no, and they're terrified. But by the third time, they're just as relaxed and calm on that water because it feels so good to them in the end.
Oh, yeah.
It can help to, just floating them can help to restore motion for the patient. Maybe they've lost, you get in this cycle. Something hurts, you don't move, they get stiff and tight, so it hurts, and then you don't move till the point you're really, really stiff.
I hear you saying that many people are afraid to actually go in the water.
Honestly, we don't have that many patients. I just want to let anyone know that may be afraid of the water that I have ways that I can help
There are
you
ways
get
you
more
can help.
comfortable with that.
Got it. Well, that's great. Okay. Do we have more toys?
We have the balance
What is
board.
that? Okay.
This
What
is
is that?
typically used for balancing type activities.
Okay,
Now, there's
what about
similar.
somebody like me who's unbalanced?
Then we would get you in the water where it's nice and safe,
Okay.
so I don't have to worry about you falling off and hurting yourself.
Okay.
I can use this as well. Let's say you've had an ankle sprain and you've
Uh-huh.
lost some motion, maybe an ankle fusion. We can stand on, your feet and kind of work this board around the floor, kind of restoring some motion.
okay.
But you don't have your full body weight on there, so it doesn't hurt as bad. But it's still very functional to what you do.
Got it. Wow.
So
Okay.
A big part of our job is not just getting you to move, but getting you to move in a functional manner.
Okay. Because if you try to do this all by yourself, you could end up hurting yourself, couldn't you?
Yes, you can.
Yes, you can. So the best thing to do is to go to a trained therapist for this kind of activity.
Yes, sir.
Don't try to do it by yourself, like some of us may have tried to do in the past. You
correct.
could end up hurting yourself even more.
Yes.
Okay. What else? What are the
I
others?
think the last thing
What
we
are-
have, these are, their technical name is, I always mix it up,
Yeah.
it's aqua fins. I have
Oh,
a tendency
yeah.
to call them aqua wings.
Aqua fins.
Yes, sir.
Okay, I knew that.
I have
Yeah.
used them for upper extremities and I've used them for lower extremities. They're another way just to resist things through the water.
Got it.
So we can, bring them to your legs and
Uh-huh.
we can do different hip exercises with these attached because it's making the surface area of your leg a little bit larger. You're scooping up more water, so it's making it harder.
That's fantastic. That is fantastic.
Now this
Is this a boogie board?
is a kickboard. They actually have these at the YMCA, so it's another piece of equipment later that patients will show them how to utilize on their own. Similar properties to what we can do with our Wonder Board here. Other things I use this for, since it's not as buoyant as this Wonder Board. People who need to really work to re-engage those core muscles, we use this just to kind of help with that.
Wow. Wow. Oh, this is great.
I just like coming to play with all the toys.
I know you do. This is great. Now, again, the difference between these two pools is
Temperature. And size mainly.
size. This is a much smaller
depth
pool.
as well.
Now, this is only 3 feet here.
This pool goes from 3 feet, at the main part, 3 feet to 4.5. We have stairs, 2 ladders, and a ramp.
A ramp.
I had mentioned patients not being able to walk that I have worked with. We actually have wheelchairs,
All
so I
right.
can transfer a patient from their chair into ours,
And
And
then
we can
roll
roll
them down the
them
ramp.
right on down.
Wow, and right into the water.
Yes, sir.
And so that's 4.5 feet on this
Four
end,
and a
3
half
feet on
feet.
this end.
Yes, sir. The other pool over there goes from 4 feet up to 12.
Great.
I have used it before. I have one patient who actually prefers the cold water, and we're doing some lumbar traction on him. So we put him in the water, floating. We have some ankle weights that we'll kind of put on his feet, and that'll help to kind of decompress that spine further, help with low back pain, any disc-related issues, and so forth.
Now I see
You're
children.
looking like
in-
you need to come see me every time
Well,
I say
yeah,
back pain.
well,
I see.
yeah, well, I'll call you. But I see children in here. Now, are these children here with their parents to work in therapy, or are they here just having a good time?
Well, there's a few things. Children are not allowed in this pool at certain hours of the day. We're getting close to the end of the day where they have swim lessons. Not we meaning orthopedic physical therapy,
right.
but the YMCA.
Right.
So they'll use this pool for that. I
Okay.
take a lot into consideration when I schedule my patients. Who's going to be best suited for a splashing child versus who needs that still water. Sometimes I use that splashing child to kind of challenge their balance more once they get really good because
Okay.
there's more waves in the water.
Right.
But then again, if they don't want to get their hair wet or their face wet, we try to bring them at a time when it's a lot more still and quiet in here.
Now, you have classes here.
I do not offer classes here in the pool. I teach a kid fitness class here at the Y.
okay.
What I do, it's all one-on-one.
Okay.
So the patients, they will go to our clinic, orthopedic physical therapy, and they'll bring a doctor's order. So whether it's from an orthopedic doctor, their primary care physician, it doesn't matter. They just need to bring us that order. We'll get them scheduled in for an evaluation, schedule their appointments. Go ahead.
You don't take walk-ins?
Right now we don't.
Okay.
We're trying our hardest to work on it.
That's
but-
okay. That's okay, but it's by
Yeah, it is by appointment.
By
So
appointment only.
you'll get that referral. You'll bring it into the orthopedic physical therapy. They're going to schedule in an eval. You'll go to the clinic that first day, and then after that they'll schedule you to meet me here. And then we'll continue here. Some patients are just in the water. Some do land and water. We try to tailor our treatment to what that patient needs.
All right, one more time. Now, I know this is Scott Gibson's
Yes, sir.
thing, right? And tell Scott I said hi. But I've known him for
Scott.
a minute. Hi, Scott. Whoa. But the name of the company again.
It's Orthopedic Physical Therapy.
Okay.
We're an affiliate of Wayne Memorial Hospital. You want the address so you guys can find
What's
us?
the address? Yeah.
It's 2808 McLam Place.
Oh,
I think
okay.
I know the phone
right
number
off Cox
too. If you
Boulevard.
want. Yes, sir.
All right, now, I know where McLam Place is. Yeah. All
right.
And what's the phone number?
919-587-3169.
Now, tell me, why would someone call you?
Why? Well,
If that is to say, if you by referral only,
why would they call me?
why would they call you?
Well, to come if they want to do aquatic therapy, obviously, but we do all different kinds of therapies.
Okay.
So if you're having any pain at all, if you're just wanting to improve your overall health, if you've had any surgeries,
Okay.
anything at all,
I
give
got
us a
it.
call. We can let you know if you're appropriate or not. Why I say come to me or us for aquatic therapy is because we've had special training. So we've had training.
Tell
through
me
the
about
Yep.
your training. What's your background?
I actually went to Nash like this guy here did, starting out, and then I've had additional aquatic training through the American Physical Therapy Association.
So you know what you're
So,
doing.
I hope so. I'm still learning though. We're always learning. That's the
Okay.
thing with this
Well, yeah.
profession. So
There's always something
we
new,
try to
isn't
stay on top of it.
All right, very good.
So the rest of our staff, we're working hard to get everyone trained, but we have a few other people in the pool with me, and they're just as competent.
How many can you take at one time?
We do all one-on-one
One-on-one.
treatments. We can
good.
have more people in the pool because we have other therapists that are trained as well to do that.
Okay. First of all, I want to thank Paul Lascara. Thank you, Paul. Appreciate you coming by and talking with us. And
Thank you, Wayne.
Sabrina Kornegay,
Yes.
thank you so much.
Thank you.
I appreciate
Nice
all
to
that
meet
great
you.
information. I'm not going to make you get in the pool today if you
okay.
promise not to push me in. Okay? Thank
sure
you
you
very
wanna
much.
go for a
No, I don't
quick
want to go. No. Thank you very much.
All right,
All right.
thank you, Wayne.
And from the Goldsboro Family YMCA.
Yes.